An erection that lasts more than 4 hours is actually not a flex, it's a medical emergency. This is Dr. Shali Veronica Achoka, and this is your Ultimate Uro Guide. Today we're going to look at one of the other urological emergencies called priapism. This is where you have an erection for more than 4 hours that is not necessarily associated with a sexual stimulus. And most of the time, it's time-bound, time-sensitive. The longer you stay with it, the more detrimental the effects are to your penile shaft. So who gets penile priapism? Who gets these prolonged erections that are unwarranted? There are two types of priapism. There's one we call high flow, there's one we call low flow. This is in relation to the mechanics of how blood flows within the penile gland. One is very painful. Once you have it, there'll be so much pain, you will bring yourself to the ED, to the emergency department. And the other one is low flow, not high flow, where it's not as painful as the previous one, but still is priapism and has side effects on the penile shaft. So when we talk about the two, who gets it? Essentially, the risk factors for getting priapism is blood issues with your blood, like disorders of sickle cell, leukemias, the different types of blood dyskaryosis that can associated with blood. And then there are drugs. There are drugs that could be drugs of from medical conditions like psychiatric conditions, and there are also drugs that people normally abuse that could cause priapism. And there are also medications that can be given, especially for patients with erectile dysfunction, that can lead to priapism. So these are among the factors that can lead you to get priapism, the prolonged erection. And given that it's a medical emergency, you need to come to the emergency department as soon as possible, because any delay, any prolonged time puts your penile shaft at risk for fibrosis and loss of function. If it lasts for more than 4 hours, don't Google it, don't buy time, rush, seek medical care so that intervention can be done on time and we can salvage the penile gland. This has been Dr. Shali Veronica Achoka, and this is your Ultimate Uro Guide.